Hey guys, it's Sarah here. In this video, I'm going to be going over skin conditions and infectious diseases that you have to know for the NCLEX-RN. So before I get started, you should just know that this video and all my NCLEX-RN reviews are available in a PDF form. If you want, you can look at the link below to get it, or you can go to my website at www.sarah, so that's Sarah with an H, rn.com. So let's get started. Okay, so the first one we're going to talk about is scabies. So just a quick thing before I start is that with all these stuff, you don't have to know everything about them. You just have to know what makes them stick out. So for instance, this one looks like a butterfly. This one is going to feel like this, etc. Just know what sticks out for them. And that's where you're going to decipher, because NCLEX is going to have that like sticking out phrase. It's going to be in the question. So that's pretty much that. So scabies, the thing you want to know about scabies is that it is transmitted through contact. So when you touch someone else, etc. It looks like it does on the right over here in the picture. And the main thing you should know for that, it causes intense itching. The treatment for that is going to be permethrin cream for all. And the reason I say for everybody or all is because anyone in close contact with the person, even if they don't have the itching and they don't have it yet, they still should be treated with the permethrin cream. That's going to be massaged like all over the skin. Okay, the next one is C. diff. So C. diff is actually a bacteria, and what happens is that it causes severe diarrhea. They keep going in the bathroom. And they could also have like nausea and fever, but just no severe diarrhea. And the reason why it happens is because the normal flora in your GI system, it gets like totally destroyed. So something that could cause it to get totally destroyed, which will cause C. diff, is antibiotic use, especially for a prolonged time. It's transmitted through contact precaution. So if you're changing a patient, you want to watch out for that. You want to place the patient in an isolation room, and the treatment is going to be antibiotics. You want to tell so for this is the one that you want, so most of the time you wash your hands with alcohol, etc. But this one you want to do water and soap. So remember, water and soap for C. diff, it causes severe diarrhea from antibiotic use. The next one is multi-drug resistant organism. So these are bacteria or microorganisms that develop a resistance to antibiotic medication. So basically when you give them the antibiotic, it's less effective against whatever they're trying to fight. So when this happens, it makes it more difficult to treat that organism because you have one more antibiotic you can't use against that organism. So just know for those that these are two examples. MRSA is a big one, and VRE. Okay, the next one is Ebola. Ebola is also called viral hemorrhagic fever. It is very contagious with a really high mortality rate. It's basically a virus that causes severe fever and severe internal bleeding. It has like every precaution. You know, you're going to need the droplet, the contact, the airborne, just every precaution. They're still working on treatment, so there's no like one treatment, but the PPE is a big thing. The next one is E. coli. So E. coli is an abnormal bacteria that lives in the human body. Most strains are harmless, but a few of them could cause like severe abdominal cramps, bloody diarrhea, and vomiting. So just know that E. coli is a bacteria that lives in you, and when it's mostly harmless, but some of them could cause GI symptoms. It's usually passed between people from contaminated food or water, and the treatment is basically preventing dehydration, and it improves by itself. Okay, Middle East respiratory syndrome. So this is a viral respiratory illness. It's transmitted through respiratory secretions, so if the person coughs, etc. The symptoms are going to be fever, cough, shortness of breath, and it could lead to death, so it's pretty serious. The next one is West Nile virus. This is mosquito-borne disease that usually occurs during the summer months. You want to prevent it, so insect repellent, long sleeves, long pants, no outdoor activity in, like the heat of the day like that. Next one is gastroenteritis. So this is the regular stomach flu. It's basically inflammation of the stomach and intestines that causes nausea, vomiting, diarrhea. You want to give them fluids and tell them to keep drinking, basically. So with a lot of these viruses, you don't really treat them except for supportive care. And the main thing is you want to watch out for is to prevent dehydration. So you want them to drink. Question. The home health nurse is caring for a client with scabies. When instructing on the proper procedure to wash pre-worn contaminated clothing, which nursing instructions is essential? A, they should use commercial grade laundry detergent. B, they should pre-treat the clothing where the scabies contact exists. Wash clothes through 2 laundry cycles or use hot water through washout cycle. I'll give you a minute. So you want to use the hot water because it kills the scabies and infectious agents on laundry. Okay, so the next one is tapeworm. So I'm just letting you know this is like going to be a really boring PowerPoint. There's no real way to make it interesting. It's more like just remembering the key details. So tapeworm, it's ingested when a person eats food that's contaminated with feces or undercooked meat from infected animals. And the symptoms you're going to have is basically worms. And usually they're found like after they make like a bowel movement, or they'll see them in the toilet bowl. It's pretty gross. Ringworm is called Tinea corporis. It's superficial fungal skin infection that happens on the skin, hair, and nails. It's highly contagious. It's transmitted by contact, so like spread by hairbrushes, hats, towels, etc. The symptom, as you see on the right side, it's going to be red, scaly, blistery rings on the skin that grow outwards as the infection spreads, as you see in this picture on the right side over here. And the treatment, because it's a fungal infection, is going to be antifungals. Okay, so now we move on to other skin conditions, which is quite common. Eczema. Eczema is also known as atopic dermatitis. It's actually an autoimmune disorder that causes the skin rashes, as you see in this picture on the top right. It is not contagious. That's a big thing. They like to ask that. It is not contagious, and it's chronic. So it could be very itchy. It's going to be dry skin, red skin. It's very common in infants, but yeah, like especially before 1 year old. And a treatment for this, you really want to alleviate the itching. So tell them not to scratch it because you're worried about a secondary infection. You want to keep their nails short. You want to pat dry them after a bath and put like some moisturizer on it, and avoid triggers that could cause that. The next one is psoriasis, as you see over here in this picture. And that's also an autoimmune disorder that causes rapid turnover of epidermal cells. So they're going to have symptoms of dry, scaly, red, silvery plaque. The treatment is, there's really no treatment, just avoid the triggers pretty much. The next one is impetigo. Impetigo is highly contagious actually. It's a bacterial skin infection. It usually occurs in kids in like really hot weather. As you see over here, this is the picture of that. The symptoms are going to be itchy, burning, red pustules that when they rupture, as you see in this picture over here, they turn into honey-colored crust. The treatment is going to be antibiotic ointment, and 24 to 48 hours after taking it, they're not contagious anymore. Okay, so poison ivy. So poison ivy, you should know, is not contagious. That's a big thing that people are like, oh, you have poison ivy, I'm not going to touch you. So just know it's really not contagious, even though people think it is. And the first thing you want to do for poison ivy is rinse out. You always want to wash your hands first, and yeah, just know it doesn't spread. The next thing is bed bugs. So bed So bed bugs could cause, as you see, this is like just a picture of the bed bug. They could cause an itchy red rash. And you want to launder the clothes in hot water, put everything on the highest temperature. You want to store it in tightly sealed plastic bags. And if you do see it in like a classroom or place, you want to get like a pest control to come see everything else. And you also want to know you should treat the entire home, not just like the place you found the bed bug. The next one is Lyme disease. So this happens after someone gets a deer tick. Symptoms is actually like flu-like symptoms. They're going to have headache, fever, fatigue, and then they get a bullseye rash. As you see over here, there's like a circle and then a circle around it. So that's going to be the classic symptom, because when someone comes in with headache, fever, fatigue, they're not going to automatically think of like Lyme disease. So when they come in with a bull's eye rash, that's like definitely the Lyme disease. You want to give them antibiotics and remove the ticks with a tweezer. To prevent the bite, you want to give insect repellent, avoid tall grass, etc. Okay, question. So after the nurse teaches the mother of a child with eczema how to bathe her child, which of the following statement indicates effective teaching? So number 1, I let my child play in the tub for 30 minutes every night. Number 2, my child loves the bubble bath and I put him in the tub. Number 3, when my child gets out of the bath, I pat dry the skin. And number 4, I make sure my child has a bath every night. So the answer is C. When my child gets out of the bathtub, I just pat dry. You want to avoid a bubble bath because it's irritating, and the goal, like we said before, is to decrease the dryness and itching. Okay, candidiasis. So candidiasis is a fungal infection. As we see in the picture over here, that's a pretty like severe-ish form. But anyways, it could occur in the vagina or the mouth. If it's in the vagina, it's a yeast infection, and they're going to have symptoms like burning, itching, and cateches-like vaginal discharge. When it affects the mouth, it's called oral thrust, like you see in this picture here. And the symptoms are going to be like pearly, white, curd-like patches on the oral mucosa, just like this. So just know like the symptoms because they stick out a lot, especially like the cateches. And the treatment for that is going to be antifungal. Okay, so bacterial vaginosis. So bacterial vaginosis is an overgrowth of the vaginal bacterial flora. So like I said before, the flora is normal to be there, but when there's an overgrowth of it, that's not normal. So that's called BV, which stands for bacterial vaginosis. And the main thing that sticks out here is it causes a fish-like odor. They like to say fish-like odor. And this is not really serious at all. It's just treated with oral antibiotics, and that's pretty much it. The next thing is rabies. So rabies is a severe virus that could cause when an animal bites a human. It could be deadly, and it affects the nervous system specifically. The next one is purpura, however you pronounce that. So basically that's a red purple discoloration that does not blanch with pressure. So it's not like if you push it down, it won't get lighter in color. So basically it's symbolizing that there's bleeding underneath the skin. The next one is acanthosis nigricans. So what this is a systemic hyperpigmentation plaques. It usually occurs in like the neck area or under the armpit. It indicates insulin resistance, so you want to refer them to a doctor like an endocrinologist for undiagnosed diabetes. Okay, so herpes zoster. So herpes zoster is called shingles. Shingles come from the same virus as the chickenpox. So someone gets the chickenpox when they're younger and it can reactivate, and then it's called shingles. As you see in this picture over here, here's a picture of shingles, and here's a picture of chickenpox. It presents as like shooting pain that turns into red, fluid-filled blisters. And then over the next 7 days, it dries and crusts over. When it's open and not crusted over yet, then it is contagious. And it's contagious by air and contact precautions. And what you want to know is that there is a vaccination against it, and you could be vaccinated. Okay, tuberculosis. So tuberculosis is a bacterial disease that affects mainly the lungs. So you should know about this, that it's airborne precautions. So when you think of airborne, you're going to think of a N95 and a negative pressure room. They're going to have respiratory symptoms. So the respiratory symptoms are going to be, a cough, sputum production, shortness of breath. Besides for that, they're also going to have night sweats, a low-grade fever, and anorexia and fatigue. In order for it to be diagnosed, you have something called tuberculosis skin test. A PPD, because everyone knows, PPD test. So the PPD is actually the solution that you're going to use. The test involves 2 different steps. What they do is that they inject it in the arm, and then 48 to 72 hours later, you have to come back and get it read. If there's a red area, which is called induration, and if it's more than 50 millimeters, then it's a positive response. This does not mean the person has active TB. It only means that the person was exposed to TB in the past. An alternative to the tuberculosis skin test is a quantiferum, which is a blood test, and that measures how the immune system reacts to TB. So positive means that the person is infected with TB. It is more expensive to do, so it's not done like the first thing, but you could go to the doctor and get your results in like 24 hours. Another alternative to be diagnosed is acid-fast bacilli, which is basically you cough up sputum and they collect it, they stain it with a dye, and if it turns red, it's TB. They could also have a chest x-ray, which will show infiltrates that could lead you to tuberculosis. The thing about tuberculosis is that once they're diagnosed, then the patient needs to be on medication for 6 months. So that's why a lot of patients are very non-compliant. So you want to watch out for that. Besides for active TB, they could also have latent TB, which they have no symptoms. They're not contagious, but they'll have a positive TB skin test. Okay, then we go on to influenza. So influenza is the flu. Everybody knows about the flu. It's transmitted through droplet precaution, so it means like sneezing, coughing, speaking. Like if you stand within 6 feet of someone else, it could go right into you. Symptoms are going to be your flu-like symptoms, fever, chills, muscle ache, headache, sore throat, nasal congestion. The person will be like, I'm just not feeling good, The treatment for that is going to be rest, hydration, humidified air, antipyretics like Tylenol for fever. And antivirals could be given like Tamiflu, but they're not really given for people who are regular healthy people. They're usually given for people with comorbidities and stuff like that. There is a vaccine to prevent it, and that's pretty much it. Okay, question. So your patient is diagnosed with latent TB infection, needs a bronchoscopy. During transport to endoscopy, the patient will need to wear number 1, N95 mask, number 2, surgical mask, no PPE, and face mask with shield. So let's give you some time. So because it's latent, so it's not active, there's no special PPE. Okay, so now we go on to STDs. So the first type of STD we're going to talk about is genital herpes. So this is caused by the herpes simplex virus usually. And the symptoms, a lot of times they're asymptomatic, so they'll have no symptoms, or they'll have the blisters. So the blisters could be in the mouth or the genital area. So that's going to be like a key feature of genital herpes. It's highly contagious, and even after the lesions heal, they're still contagious. What you want to know is that could be passed onto the child during birth. There is no cure for genital herpes, you just treat the symptoms. Don't scratch them because, it could transfer, clean with warm water, soap, etc. The next one is trichomoniasis, which is also called trich. So with trich, the main one you're going to have to know is yellow-green frothy discharge. That's going to be your key word. Yellowish, greenish, frothy discharge. It could also have painful sex, itching, etc. But your main one is going to be the yellow-green frothy discharge. Treatment is going to be Flagyl. You want to tell them to abstain from sex until the infection clears, and no alcohol while on Flagyl. You also want to treat the partner for it and use a condom. The next one is gonorrhea. So for gonorrhea, you also want to treat a partner, no sex until the treatment is completed. And for gonorrhea, what you want to know is it could be transmitted to the baby in birth. So to prevent this, the baby gets erythromycin in the eye. One big complication of gonorrhea you want to watch out for is pelvic inflammatory disease and infertility. A lot of times it's asymptomatic, and you should be screened. Everyone should be screened, anyone who's sexually active and less than 25 years old. So just one quick thing. So STDs, a lot of people are mistaken that STDs, even if you're on birth control, they don't prevent it. A condom could prevent an STD. Okay, so chlamydia is actually the most common form of an STD, and risk factors are going to be multiple sex partners or a new partner. Prevention, everyone under 25 should be screened, or above 25 if they're at risk, and the baby gets erythromycin. Symptoms, a lot of patients are going to be asymptomatic or just have minor symptoms like spotting, abnormal, a little bit thick discharge. The partner is also given treatment for this, and complication is the same thing as the gonorrhea, the pelvic inflammatory disease, and infertility. Next, we go on to human papillomavirus, HPV. So HPV, what you want to know for this is that it could cause genital warts and cervical cancer. So just think HPV, genital warts, cervical cancer. There are a lot of different strains, but type 16 and 18 is the one that could cause almost all the cervical cancers. It's usually asymptomatic, and the warts are actually painless. It could be transmitted through sex, like oral, vaginal, anal sex, and even with no symptoms, it could be spread through sexual contact. It could be passed to the baby at birth, and to prevent it, you want to get the HPV vaccine before being sexually active. Usually it's given at 11, 12 years old. The next one is HIV. So HIV is a viral infection. The virus actually attacks the CD4 cells, and CD4 cells help the body to fight infection. So if they're attacking it, then the person is going to be at risk for infection. If the CD4 count goes below 200, then the person is said to have AIDS. So 200 is the magic number. And if it goes below 200, there are huge risks for infection. It could be passed to the baby at birth or through breastfeeding. It could affect the patient for years with no symptoms. Intervention, so first of all, it's standard precaution. There's no like airborne or droplet or anything like that. They should be up to date with their immunizations. They shouldn't eat any raw food, just any, like all those interventions for someone who's immunocompromised or someone within a low immune system. The treatment, so you should know there is no cure at all. They have ARTs, which is antiviral therapy, but it doesn't cure it. The treatment is lifelong, and they need to be on a strict adherent to it. Okay, vaccinations. So vaccinations, what you should know about vaccinations is that a few stuff. Number one, someone severely immunocompromised, like patients, like someone on chemotherapy, like AIDS, like we just said, or someone on a steroid, because that also decreases the immune system. They should not get any live vaccine. So live would be like the measles, mumps, rubella, rotavirus, varicella, zoster, etc. You could give a patient, you should know this, you could give a patient a vaccine even if they have a penicillin allergy or a mild illness or they get a recurrent infection or if they're on antibiotics, you could. Normal vaccine reactions, because everyone's like, oh, I got a vaccine, I got a reaction, but some are normal because your body is producing a response, an immune response, which is normal. So normal vaccine reactions are mild fever, soreness, redness at injection site. You could just tell them to put a warm compress on it and take Tylenol. A patient with a history of seizure should get a separate MMR and varicella vaccine, and not the combination. The pneumococcal vaccine is given to all adults above 65 years old, and they should get 2 of them. You should teach them also to stop smoking, proper cough methods, and other stuff, avoiding crowds with respiratory illnesses, etc. Okay, so here's the vaccine schedule. This over here, like I basically just divided it by the months you have to know, and it's basically memorization. But if you look, you could just kind of see like 2 months, 4 months, the same exact thing. The only difference is you don't have BF 4 months. So you could kind of just like not memorize everything, just memorize one and then be like minus this in this month, plus this in this month, etc. Question. When assessing a patient who will be receiving a measles vaccine, the nurse will consider which condition to be or indication. Anemia, pregnancy, ear infection, and the common cold. So which one could you not get the measles vaccine? It's going to be B, pregnancy, because you can't have live vaccines like the measles. Okay, so that's it. Thank you so much for watching. If you want any of my NCLEX-RN videos, you could check them out in the link up there. And if you want this whole thing in a PDF form, don't forget to go to my website, sarahrn.com, or look at the description box below. So good luck.